Station number 1. Name the cranial nerve and its structure and function. Station 2. Red tape, blue tape. Name the structure and function. Be specific. Also, what would a lesion, i.e. an injury, tumor, God forbid, anything were to happen to these areas, how would that affect your patient? Station number 3. Where the red tape is, there is a specific lobe of the cerebrum that sits there. What is its structure? The name of the structure, and what is its function? Station number 4. Name this brain structure. Be specific and identify its function. Station 5. The red pin with the number 5 on it. Not just that point, but the entire swelling here. Okay, so all this between here and here. What is that called? What are the specific components? And what is this area of the central nervous system responsible for? Station number 6. This cranial nerve is motor to the following muscles. What are the muscles that I have circumscribed here? And what cranial nerve powers them? How would you test them? Station number 7. The orange tape. The red tape indicate the same structure. What is its name? And what does it do? Station number 8. Peripheral nerve, indicated by the red tape with a star. Name of the nerve, and how would your patient present to you in the office, in your ER, etc.? What kind of pain or symptoms would they be experiencing? So what's the name of the peripheral nerve and the specific symptoms? Station number 9. Not just the point, but the circular area around that point, that kind of pale area, entire area about the dimensions of my thumb, right there above the brainstem. What is its structure? What is its function? Name the 3 meninges. Be specific, use Latin names. And what are the functions of the meninges? And what kind of, would be an infection of the meninges? That would be a medical emergency. Station number 11. We've got a neuron model, and we've got a piece of red tape. Just got me so motivated just checking out this A&P. Station number 12. Pin with the red tape on it. What are we looking at? Structure and function. Station number 13. There's a clinical condition, and how would the patient be presenting? I had a fart, excuse me. So the red friggin' thing is pointed, stuck in a red booger coming out of the spine, or part of the spine anyway. What happens if there is this clinical condition? What's it called? What is it a disease process of? What kind of tissue is affected? And what's going to happen to this nerve nearby? How would the patient present? Station number 14, red tape. Name the structure and the function. Number 15, structure and function of this alien-looking structure. '16. We got an aquatic environment. Those arrows are pointing to those hollowed out chambers in this brain structure. And this also has something to do with it up top. What's it called? Structure and function. Okay, we've got a sagittally sectioned brain, and we've got that blue structure deep into the tissue. What is that? And the pink structures here, this represent the same thing. So what are they? The blue and the pink are the very same thing. What's their structure and function? Station number 18. There's been a peripheral nerve injury. What is the clinical condition called? And what nerve is affected? '19. There's a heart. There are intestines, stomach, liver. There's a specific cranial nerve that powers the viscera. What's the name of that? 20. Green now. It's wrapped around a nervous structure. What's that called? Beat it. 21. Structure and function. Bunch of turds out there. All right. Identify the three structures. 1, 2, 3. Any three structures, though, that you see that you can name the structure and function. These are all components of the eye. So what are their specific names and what is their function? Station 23. Name 2 structures that are present and tell the story. How do these 2 structures function together? Station number 24. There's a bunch of structures present, of course. I'm looking for this one with the pin sticking out of it. What is it called? How does it function? Purpose does it serve? And for number 25, we see some structures we recognize. But there is a pin that is sticking in this circular structure. That's kind of positioned right in between them. What is that called? What's its function?